Good afternoon, everyone.
Little louder.
Sure. I can come in. This is the mic here?
Yes.
Okay.
Nonetheless,
Okay, sure. Good afternoon, everyone. And I thank Group Captain Mohandas for this kind introduction, and C2 for calling me here, and also Reddy's Lab for facilitating me to come here and give a talk. So I will first try to tell some general points regarding cancer awareness, and whatever concerns Group Captain had regarding the fear of the word and the various aspects, we'll try to cover them the next 30-35 minutes. First thing is, why have we all assembled today? Whether cancer is a problem of big magnitude or is something very, very rare. To understand this, we just need to know MGR's old movie, Ayrathil Oruvan. So 1 in 1000, so 10 in 10,000, that means 100 per 100,000 population. So if we have a small village or a reasonable size district or a panchayat which has 100,000 population, 1 lakh, so we can expect every year 100 new cases of cancer to come. So that's the statistics in Chennai, Tamil Nadu. We get this information from the Madras Metropolitan Tumor Registry, which collects data on cancer. So it is a problem of considerable significance. And another issue is this problem is increasing. Because when I started out work in cancer in 92, it was 91 to 92 per 100,000 population. And now, like I mentioned, it's almost 101 to 102 per 100,000 population. So why is it increasing? There are two important reasons for us to understand. A, it's increasing because we are living longer. Our grandparents or their own contemporaries in the 1920s and 30s, we were living for about 30 years and 32 years. Then slowly 50 years. And now we are expected to live, each one of us, to 66 years of age. So slowly ours too will become an aging population, just like the Western figures. If you look at a developed country, they live till about 75 to 76, or in some countries even up till 80 years of age. So as we live longer, we are subject to more mutations, abnormalities in our cells, and the incidence of cancer will go up. Now that we are not dying of other reasons, ultimately the burden of cancer will increase because somehow we have to die. So that is one important thing to understand. And the other reason for increasing is general westernization of the whole society. To explain that would be difficult in one single word or sentence, but overall our exercise ability is less, our food habits are different, our weight is more. The various things which are connected with westernization also causes an increase in cancer incidence. So it's going to be of a significant problem in our country, and by 2050, which is not very far away, 50% of the world's cancer will be in India and China. So that's how big the problem is. I'm trying to change this slide. How do I do it? I press this, nothing happened, then I press, okay. So the first thing is, what is cancer? So if you ask this question, almost everyone in the group, it need not be a medical person at all, everyone will be able to give a clear answer. There is increased proliferation of cells. So there is increased growth, and that is what is cancer. But remember, one very important aspect is loss of art of dying. That also is very, very important. All of us in this room are alive without cancer, and everyone outside are alive without cancer because our cells have the ability to die. Whenever it has completed its job, whenever it has completed its normal lifespan, there is what is called as a process of programmed cell death. So millions and millions of cells are every day dying, and appropriately, without making any problem to us. Millions and millions are dying as I speak, cells are all dying. If the cells forget to die, so nowadays we all learn of art of living, but for us to be living, our cells have to know the art of dying. So whenever they forget to die, that is also another important reason for getting cancer. So increased proliferation on one side, again you forget to die, both of them combine and we get a purposeless mass of cells which is going to prey on the host and ultimately will kill the host if not treated. The other important thing which we all should know, because very interestingly, if you had read 2 days back, there was a big article in the Express about one major surgery done in GH. So malignant cancer was written. So it was such a, coming from a big newspaper, the word should never come. They should have checked with a basic doctor. The word malignant cancer will mean cancer or malignant. Cancer is malignant. So we in this group today should understand that tumors are of two types. One, any tumor can be benign or a tumor can be malignant. And what is going to differentiate is the 2 points which are important. A malignant tumor has capacity to invade the surrounding structures. It is there in place A, let's say my shoulder. When it grows, it will try to penetrate down into my muscle, into my bone, or try to explode outside by breaking my skin. So first property is invades locally. Benign tumor, generally what it will do, it will only push the other people away from it. It won't try to invade. I may push group captain away, that is one way of doing, or I may invade into him. So that is important. Other thing is it goes places. A malignant disease has ability to leave its primary place and go to some far away place and settle down. It may be in my shoulder, but it can travel to my lung, it can travel to my liver, it can travel to my brain and sit very quietly without making any difficulty. Akin to, they will be quiet and sleeping. And then suddenly when opportune movement comes, they will come back. This ability of this tumor to go far away is called as metastasis. So malignant tumor has capacity to spread out. Malignant tumor locally invades. So that is what is a malignant tumor. Cancer is a malignant tumor. So we should be very clear, there are many benign tumors which are not malignant. They may not really cause any problem to the patient, like tumor of the fat, tumor of sometimes muscle like lipoma, fibroma, etc. Then how do we diagnose cancer? So this is it's a big question, and in the movies it will all be shown in one way. Suddenly he's bleeding from here and there, or he's coughing out blood, or losing weight, etc. Well, by keeping the hand on the pulse or anything like that, we cannot diagnose cancer. We have to remove the tissue from the tumor or from the body, and this tissue should be seen by a doctor who is called pathologist under the microscope. So A, we have to remove tissue. B, it has to be seen under the microscope by a pathologist, and he or she will say this is malignant. And this is a very, very important thing here, because most of us sitting in the room or elsewhere always will be under this concern. If you touch the tumor, if you keep knife on the tumor is going to grow, explode, and it is going to cause dissemination. That is a common layperson thoughts. So this slide is to inform that appropriately done biopsy, that means removal of tissue, is called biopsy, does not cause any increase in cancer or spread of cancer, and it is the mandatory first step to get the diagnosis of cancer. And then obviously the most important thing, how it is treated. the oldest form of treatment is surgery, where they remove the tumor. Radiotherapy, where you treat with X-rays, and then chemotherapy, where we use medicines to treat cancer. Then we have one important concept. Remember what is called as the multidisciplinary concept. Initially, every disease one doctor will treat. But remember, cancer is not to be treated generally by one doctor. It needs a big group of doctors: physicians, radiation oncologists, surgeons, pathologists, radiologists, occupational therapists, so many people, counselors, all are needed to in one big team to take care of one patient, and never by individual doctors, because most times cancer needs more than one type of treatment to cure. And another important thing nowadays is organ conservation. If you go to a proper oncology team who are well versed with all the treatment aspects, good benefit will come to the patient. How? Initially, if there is any tumor, the whole organ used to be sacrificed. If there is breast tumor, remove the breast. If voice box tumor, remove the voice box. Tumor in the hand, remove the hand. This leads to poor body image. So what is the concept nowadays is, if we can preserve the organ, preserve it. That is done with the help of all teams. So just single team cannot help in preservation. So the important message in this slide is, cancer is to be treated by a group of specialists, and now they are looking and thinking differently, try to preserve the organ without compromising on the long-term longevity of the patient. This slide will take some other time. So these are some of the common cancers in our country. If you look, the top 3 will be changing every year, and this is all from South India. I am telling, from Chennai specifically. So stomach cancer, esophagus is Gunavukara, lung cancer, head and neck, that is in the oral cavity, voice box, cheek, tongue, all of them are head and neck, and non-Hodgkin's lymphoma, that is a tumor of the lymph nodes. Woman, look at it, there's breast, then cervical cancer, that is Garbhapai Dwaram, ovary, that is Muttapai, head and neck is again the mouth, etc., and non-Hodgkin's lymphoma. So these are the common cancers in South India. If there are people from the north who are on the webcast, gallbladder cancer, for example, which is not at all common in here, is one of the commonest cancer in the Indo-Gangetic plain. If you are in UP, Bihar, Northeast, rampant gallbladder cancer. So some cancers have unique locations in our country. So, but this is one of the common cancers in South India. Well, this is an important slide which we need to come to. Is there any way to prevent cancer? When I started out training in medical school in third year, we have pathology. That is the first time we read about cancer. I was quite excited. I removed the cancer chapter. The first line there was, if you want not to get cancer, there was a gap. You should not be born at all. So that was in 1984 when I started my training. So if you are born right from birth, even before the child is born, it can have cancer in vitro. As it is born, it can have, and right till we die at the ripe old age, we can get cancer. So no age is exempt from cancer. But is there ways in which we can prevent? So which we shall look closely. One is primary prevention. That means I should not get cancer. The people here should not get. The community should not get. So first thing is, say no to tobacco in any form. That is the most important message today. Though nicely in the TV and the movies, whenever the hero or villain is smoking, caption is coming nowadays. Smoking is injurious, nice caption is coming. But we need to really put it into the community that saying no to tobacco in any form. Healthy diet, that is very, very important. Look at the colored fruits and vegetables. They have a very important role in preventing cancer. So we should have a significant portion of fruits and vegetables. Exercise, I'm also not saying that I'm regularly exercising, but each one of us, I think we should take clue from Group Captain Mohandas. He looks the most trim here. So we need to exercise at least about 40 minutes a day. That's very, very important. Then we'll look at these things in slight more details. Tobacco is the only consumer product which killed even when used as intended by the manufacturers. So that's very interesting. So basically there are many chemicals. Actually there are more than 1,000 chemicals in the smoke when we take the cigarette. What we inhale is called as the mainstream smoke. We take a drag, it's mainstream smoke. What we keep in the hand between the drags is the side stream smoke. Both are equal, same. But luckily, when you keep it outside, it gets diluted in the atmosphere. So the other person gets a lesser dose, but the same dangerous chemicals. Mainly the polycyclic aromatic hydrocarbons, which cause DNA damage and cancer. So that is a very important point. So this is just to tell you it's such a difficult habit to quit. See, the man on the right has voice box cancer, for which his voice box has been removed by the surgeon. And he has a permanent tube in the neck. He has to breathe through a hole. It's called as the tracheostomy. But he's smoking through the tracheostomy. See, that is to tell the community that it's a very difficult habit to quit. But we can quit. But it's a very, very difficult habit. And this habit goes right up to the grave. And all of us have heard this, that stopping smoking is very simple. I have done it 100 times. That means we'll stop, we'll start. Stop, stop. We can't stop it permanently. So the message in this slide is, this is a habit which is very difficult to kick. And the best way to do is not to start at all. And in the audience which is sitting here, nobody is going to start at this age. It's going to start at 17, 18 to 25, and very unusual after the age of 30. Very few people become smokers after the age of 30. So we need to permeate the message that don't start. Then obviously, if it's a medical college or engineering college, and when the finances run thin at the end of the month, we'll smoke beedies. Many of us will go out and smoke beedies, and they'll come happily telling that the beedi is very safe, there is no problem. I only leaf, nothing will happen. This is just to tell you that beedi is equal to or worse than cigarette. The answer is any form of tobacco, hookah, cigar, beedi, cigarette, tobacco, snuff, all are harmful. So we should not get into that. This is just to tell that, well, we don't have to get cancer. That we will get when you are 60 or 70, but we will die before that also. We can, because of stroke in the brain, or because there is a clot in the artery to the heart. We can get an acute heart attack and die suddenly. So there are many reasons for stopping smoking. So these are all the various forms in which we can have tobacco. Women, very interesting. In rural India, women consume a huge amount of tobacco. They don't smoke. In urban, higher affluent areas, they do smoke nowadays. We have seen in Chennai also, we do see outside few ladies smoking, which is a very unusual sight, but we do see nowadays. But they use tobacco. All our grandmothers use nicely tobacco. That is, and they do unusual things in Andhra Pradesh. Woman in Srikakulam district, which man cannot do. Man smokes cigarette normally. Woman can smoke with the burning end inside the mouth. So they do amazing things, ladies. So one such thing is they will smoke with the burning end inside and nicely get palate cancer, cancer of the oral cavity. There was a missionary surgeon from UK who was working in India in 1920s in Kerala area, Dr. Kinney. He used to be surprised that they have one, most men he's seeing has one nice laddu-like thing in the mouth. So then he found out either it was tobacco kept here or the cancer producing a laddu here. So that's how he associated tobacco with cancer way back in 1921 to 27. Well, this is very dangerous. So all of us who are not smokers, we have right to ensure that we are in a non-smoking environment, because like I said, the passive smoke also has the same carcinogens, but fortunately diluted. But spouse of long-time smokers, they have increased incidence of bronchitis, asthma, increased incidence of lung cancer. And unborn child in the tummy, if its mother is smoking or she's exposed to smoke, can become small in size, what is called as intrauterine growth retardation. So passive smoking also has a lot of negative points. Obviously, cinema is now they are helping us to curtail smoking, but most times, even I grew up very interestingly. When I grew up, I used to look for the Marlboro cigarette packet somebody will throw on the road rarely, pick it up and take the cutting, because there was a very interesting cowboy who used to be riding, very interesting photograph in the Marlboro cigarette. I used to collect that. I myself used to go and cut it and keep it in my house. And when I later joined my training, he died of lung cancer. That man, whose photo we all used to keep, died of lung cancer of smoking. So the most important message I would say for today is tobacco is the most important carcinogen on this planet, and we should make every endeavor not to start. If we have started, make every endeavor to stop today and try to permeate this information into the community. So all colored fruits are good for us. They are antioxidants, help us to get rid of the cancer. So this is very important. But nothing about non-vegetarian diet. Non-vegetarian diet can be fully taken. There is no problem, except increased consumption of red meat in large amounts can be detrimental. So normal non-vegetarian food is no problem. Happily it can be taken. But also ensure that food should have good portion of vegetables and fruit. So there is nothing again non-vegetarian food. This is important. So physical activity. So this is an interesting cartoon. So we just put that up. So doctor said he needed more activity. So I hit his TV remote 3 times a week. So if we keep our BMI, our weight within the normal range, there is a chance of some cancers becoming less. For example, breast cancer in women is more if you are obese. Colorectal cancer is more if you are obese. Endometrial cancer, that is uterine cancer, is more if you are obese. So if we keep more towards the better weight, we will be better. So alcohol, this is an important problem, particularly if we are smoking also. So if you smoke and consume alcohol, then all cancers in the oral cavity, in the voice box, everything will start increasing. So by itself, it causes other damages like liver problems, cirrhosis, etc., marital problems, financial problems. So many things it will cause. When linked with cigarette, it can cause all these head and neck cancers. So alcohol should be kept to the minimum, and there should not be increased consumption of alcohol at all when you are looking at cancer prevention. Well, this is a pitiable sight. You see big time advanced cancers, and we hope that we don't get to present to the doctor in this particular stage. This is because of so many things. One is ignorance in our country. One, our country being so huge, so big, and most of the population are in rural India. For them to come to this place, slowly get the diagnosis. So there are various reasons why we could come like that. But today we will try to see some of the warning signs of cancer, by which we may educate ourselves that we may present a bit early to the doctor. So though all these things are there, weight loss and cough, hoarseness, remember all these are more commonly because of common problems. If I have weight loss, first thing is I want to look lean and trim, so I want to reduce my weight, or I have diabetes, I want to reduce my weight. If I have persistent cough, then I have got some viral infection, Margai Masam, so I go out, I get some cold cough. Hoarseness of voice, I give a lecture today, evening I may be hoarse, or I go to IPL match, then definitely next day morning I am hoarse. So what I am trying to tell is, none of them is equal to cancer. So after listening to this today, tomorrow we should not be in front of the doctor. Doctor, I have cancer because the voice is changed, or you have some small problem. I have not passed motion because I went to some far off place. The bathroom is not good. I don't pass motion for 3 days. So for that and all, we should not land up to the doctor. But there is no reason I'm losing weight. I'm coughing for more than 6 weeks. There is no reason. I'm hoarse for more than 6 weeks. I had a pakka bowel habit. I get up in the morning, I pass motion. Whatever my routine was. And there's a change in that routine. It is very, very ominous and important. And particularly things like bowel bladder habit, no man or woman want to discuss that. Man is a social animal, but the only place he wants to be alone is when he's in the bathroom. All other place he doesn't want to be alone. So this I pass motion, blood in the motion, or the motion difficult, nobody will come and discuss unless it becomes such a problem that he or she is not able to bear with it. By the time we examine, it will be too advanced. So the important thing in this is, as the general population, as human beings, if we have a problem, we need to tell to someone. Even if you tell your own kith and kin, they will bring it to the notice of the doctor. For example, there's a lump in the breast. A lady is having a lump in the breast, she wouldn't want to tell anyone. It may be 6 months before she tells someone, it will be too late. But if she just tells her sister, or she tells her mother or someone, that person will drag you. Come, let's go to the doctor. So it's important. Difficulty in swallowing. That is a very, very important symptom. My father always eats like this in 5 minutes and goes away. Now suddenly my father is taking half an hour, 1 hour to eat. Every morsel he puts one bottle of water and pushes. No, he is getting old, that's why he is eating slowly. No. If somebody is taking long time to eat, somebody is pushing it with water, and he says that I am now getting old, I want to eat only pestangified sapadu or kanji, get very alert. There is swallowing problem. There is cancer could be lurking. Then, see, the answer is, if the bigger tumor is like coconut, then a chance that we cannot cure. But if you catch the tumor like a peanut size, then the chance that we can cure this individual. This concept is what is called a screening concept. First concept is primary prevention. I should not get cancer. What can I do, doctor? So we know ABCD. Even if I get cancer, doctor, I should get it early so that you do good things to me. I don't lose my breast, I don't lose my voice box, and you treat me in simple way, I live long. That is called screening. Catch it early, not like coconut, but like peanut. So how do we catch some tumors early? For example, breast tumor is a very common problem in our country in women after the age of 40, 45, 50. In urban India, this is the commonest cancer. And you strike at the perfect age. When you are 40, 45, you are in the best part of your life. You have 1 or 2 kids. Husband is doing very well because he is 50 plus. He will be in best position to do everything at that time. And suddenly we could be struck with cancer. So that's very, very important. We need to be alert. So breast self-examination is simple, which girls can be taught right from when they are 18, 19, 20, just to look once in a month how their breast looks, the symmetry is there or not, and to feel with the flat of the hand. Most of the ladies, when they are taught, they'll come running next day saying there's lump in the breast. If they hold the breast with their finger, there will be lumpiness. But you should see it with the flat of the hand. Any nipple discharges there or not. Simple things could help them say there is some problem, then they can go to the doctor. If they come to the doctor and if they are more than 40 years of age or more than 50 years of age, even if they are having no problem, they can undergo what is called as a mammogram, which can screen the breast. Previously, it was a slightly uncomfortable procedure because they have to press the breast between the 2 plates to take. Nowadays, very good mammograms are there, 4th generation mammograms, very comfortable. Point 1. 2, initial mammograms used to give some radiation. So that itself is a slight risk factor. But nowadays, mammograms give very small amount of minuscule radiation. You may need to do hundreds, which we'll never do in a lifetime. Well, this is just to tell there are so many people whom you all know, and they have all been there with malignancy. This is Lance Armstrong, who won 7 times Tour de France. Even before he won the first time, he had stage 4 testicular tumor. and then he has created all records. This is, I need not tell. And this is a very, very important person. That is Dr. Muthulakshmi Reddy, who has really worked in South India to set up a cancer unit, that is the Cancer Institute, which is the first cancer center in the whole of South India. So these are some of the few things which we shall try to answer. Can it be prevented? We have already gone through that. Cancer be cured? That's an interesting thing. We will come to that. Yes, cancer is curable if we pick it up in an early stage. But unfortunately, many times we present in late stage for so many reasons. Some cancers always present in a late stage because they have a silent manifestation. But if you catch them early, majority can be cured. Is cancer contagious? That is a very, very important question which we need to answer. The answer is no. As we counsel the relatives, as we see the cancer patient, for whichever class, you will be quite surprised. This question will be asked separately. Is it contagious? We are staying in the same house. The child is there. We are eating from the same plate. Water is there. Can you take from the same cup of water? So we should today, whoever, about 50 people of us, 20 or 10 here and 50 others linked. One thing, cancer is not contagious. Whatever I want to try, I cannot transmit this cancer. Anything I do, we cannot transmit the cancer. If I have cancer, it's only with me. It cannot go to other person by transmission. So that's important. Is cancer hereditary? That is important. Well, to tell you in this audience, the answer is there is a difference between genetic disease and hereditary. They'll quickly think hereditary and genetic are same. So the patient, if they come and it's a genetic disease, doctor will say it is genetic. Cancer is genetic. Genetic is totally different from hereditary. Hereditary means I get it from my parents, I can give it to my children. That is hereditary. Genetic is alteration which takes place in the DNA of my cell. All cancer is produced only if my DNA is altered. If my DNA is normal, I won't get cancer. But if my DNA is altered, only it is altered for me. I only will live or die with it. But sometimes 5 out of 100 or 4 out of 100, this can be hereditary. So the general answer is cancer is not hereditary in majority of us. So we will need not fear of getting it or giving it to our children. Very rare cases only it is hereditary. So our fear should be not of cancer but of delay in detection. So if you come early, cure is high, side effects of treatment is less, organ will be conserved, cost of treatment also will become less. So that is important. So hereditary and cancer, so cancer is not contagious, not contagious, not contagious. Cure rates, like I said, in early and advanced. This is very important slide. Coming to the last part of the presentation. Many of them in our country are going to come in advanced because we have few cancer centers. Actually, only in the last 10 years we have more cancer centers. Otherwise, 15-20 years back, if you look at Tamil Nadu, you have 3 or 4 major cancer centers, whole of Tamil Nadu. And North India, like Delhi capital, did not have a major cancer center 20 years back. But now, for example, they have about 7 to 10 cancer centers in Delhi itself. But in '92, cancer treatment was very minimum in even big cities in our country. So even now, many of them will come in advanced stage. And some who are treated in early stage also, their cancer can come back. This is very important that we need to make sure that our cancer patients are taken care till the end and they die with dignity, without pain. So that is called palliation, that we walk them through the process. Once we say that we can't cure you, we have to walk them through the process. This process could be 3 months, could be 6 months, could be a year before he or she dies. And we have to ensure that the death is with dignity, without pain. So that is needs palliative teams, units, availability of narcotic drugs, and doctors also to understand that we can write narcotic drugs, because many of us, without our cancer training, if there is narcotic drug, we are scared to prescribe. But we need to get out of this problem that we can prescribe, we can give narcotics to the patient so that he or she is kept comfortable at the time of death. So, well, thank you all for the patient listening. So, that's the group I work for, Madras Cancer Care Foundation, and the trust, Cancer Research and Relief Trust, which we all try to help towards patient treatment and also palliation, trying to provide palliative care at the doorstep. There is a group called as Can Care Foundation, where we try to reach out at their house to provide morphine and simple measures to keep them comfortable. So once again, thank you all for the patient listening. Any questions now? Like Group Captain Mohan Das has said, you can key it in and I'll try to answer them.